These are not guidelines, these are just ways one might approach findings in primary care settings. Today, I would like to talk about liver function tests or LFTs. And basically, these are tests, these are enzymes that are put in the blood by the liver that are, we looked at them to be at a certain level. And when they are above those levels, it might signal that there might be a damage to the liver. There might be inflammation or infection or some type of damage to the liver. And what we do in those cases is that we would like to recheck them again just to see if they are trending up or if it was something that it was just temporary and it goes back to normal. But whenever you see increase in LFTs, you just don't ignore them. You want to make sure that you follow up on that to see what happens. And there are certain things that you can do at the beginning just to make sure that if there was any damage being occurred, you could that might be occurring because of something you were doing, you could stop them. And it also gives you the opportunity to check on other things that could harm the patient if they are not evaluated. So one thing that I would do that I would that you might recommend is to a provider is to hold any medication that could be damaging, causing damage to the liver, such as NSAIDs, metformin, statin. Of course, you want them to avoid alcohol. You might want them to avoid any vitamins, as vitamins can also affect the liver, iron supplements, and because what happens is that if somebody has hemochromatosis, which uh, occurs when the body has a tendency to hold iron. If you're taking iron supplements in that situation, it would just increase the amount of iron in the blood, and that can increase damage to the liver. And you also want to suggest to decrease weight, because one of the reasons why there might be damage to the liver is because of fatty liver. And the main way to decrease fatty liver is by losing weight. Fatty liver is so detrimental that it's almost equivalent as if you were drinking alcohol every day. And fatty liver can lead to cirrhosis, and it can also lead to liver cancer. So, in regards to the blood work that you might want to repeat or do once you have labs returning with increased LFTs are a comprehensive metabolic panel, which would include creatinine and AST and ALT, which are the liver function tests. But the creatinine, you want to do it just to rule out any renal insufficiency which may occur when somebody has hemochromatosis. Also, you might want to check the lipids, because if there's increased lipids, there's increased chance of fatty liver. And also, you want to check the CBCs just to see how the platelets are doing. In case of cirrhosis, they would be compromised. So these are the initial labs that you might want to do once you have an increased LFTs. You might want to recheck the AST and ALT. You want to check the kidneys, the lipids, and the CBC. The other test that I would recommend, I would recommend highly, is to make sure you get a hepatitis viral panel. And basically, what you want to do is you want to check for hepatitis C, because some of these type of hepatitis, even without having an increased LFTs, you could still have the condition. So the fact that the LFTs are increases gives you an opportunity or a reason to check them. And as a primary care provider, it's good to have them on record that you have done this test. The hepatitis B surface antigen is to rule out hepatitis B infection. The hepatitis B core antibody is to rule out chronic hepatitis B. Hepatitis C antibody is to rule out hepatitis C exposure. And if it comes back positive, then you check a viral load. But once you have a hepatitis C positive, it means the patient has been exposed to hepatitis. And then you might want to do hepatitis A, antibody, HIV also, because HIV can damage the liver. So these are the viral reasons why there might be damage to the liver, which would increase the liver function test. So we have already our basic test that we want to repeat. We already have our viral hepatitis that we want to evaluate to rule them out. And then you might want to check out for hemochromatosis. And the way you check out for hemochromatosis is the ferritin level and the iron level. And hemochromatosis is a condition, as I mentioned before, where your body is genetically predisposed to hold or absorb too much iron. And what happens when there's too much iron in the blood, it starts depositing in the liver, which would cause an increase in LFTs. It can also deposit in the heart. It can also deposit in the kidneys, and it can lead to renal disorder, renal failure, and it can also deposit in the penis, and it can lead to impotence. Now, so we have the viral hepatitis evaluated, we have the hemochromatosis evaluated. This would be good first exams that could be done following a positive increase in LFTs, which means increase in AST and ALT. And then if all these come back positive, the next test that you might want to do is to rule out for autoimmune hepatitis. Autoimmune hepatitis is when your own body is attacking your liver, and it leads to increased LFTs and it leads to liver damage. And the test that you do to rule out autoimmune hepatitis is the ANA, the anti-nuclear antibody, which is also common finding with thyroid disorder, Hashimoto's thyroiditis, or autoimmune thyroiditis, and also with lupus, with rheumatoid arthritis, with Sjogren's. Also, you want to check for anti-myocardial antibody. The myocardial antibody is very significant because if it comes back positive, one of the main reasons that could be happening other than autoimmune hepatitis is primary biliary cirrhosis, which is a very rare condition. But once you have mitochondrial positive, anti-mitochondrial antibody positive, you want to make sure you refer them to the gastroenterologist. The other antibodies that you check is the liver kidney microsomal antibody, and also the anti-smooth muscle antibody. So these are the ones that check for autoimmune hepatitis: the ANA, the AMA, the liver kidney microsomal antibody, and the autoimmune antibody. Smooth muscle antibody. They also call it the smooth acting muscle antibody. So that's the way that you would approach when it comes to blood work. You would check for general labs just to see if the enzymes comes back positive again, the kidney evaluated, the cholesterol evaluated, the CBC evaluated. You also want to check for viral hepatitis. You want to check for hemochromatosis. You want to check if those come back normal, then you want to check for autoimmune hepatitis. The other thing you might want to do is that if you want to do the liver function test, that's just to see if the liver is working properly. And that way, what you check there is the proteins, the globulins, the albumin. So that would check the liver function. How is the liver doing its job? And lastly, you also want to check abdominal ultrasound. And the reason you want to check for abdominal ultrasound is because you want to rule out fatty liver. And what happens with fatty liver is that the only way you get rid of fatty liver is by losing weight. So that would be good information to encourage the patient to increase weight loss. The thing about fatty liver is that it can certainly lead to cirrhosis, and it can even lead to cancer. So a fatty liver is not something that you should take it lightly. So that would be one approach that one might take when it comes to increase LFTs.